The next genitourinary condition we're going to talk about is hypospadias. And hypospadias is when the urethral meatus, or the opening where urine comes out, is located on the ventral aspect or the underside of the penis. While epispadias, really tiny right here, is less common, so that urethral meatus is located on top or the dorsal aspect of the penis. For test taking purposes, I just wanted you to sort of be familiar with epispadias, but we're going to focus on hypospadias because it's more common. So again, hypospadias, the opening where urine comes out, the urethral meatus, is located on the ventral or underside of the penis. And the patient may also have a possible shordee as well, and we'll talk about that in a moment. Hypospadias treatment includes outpatient surgery at about 6 months of age to correct it, and often involves using the foreskin for that corrective surgery. So patients who have hypospadias are going to be advised against circumcision because we're going to wait till around 6 months of age, and if necessary, then we're going to do surgery to move that urethral meatus to the tip of the penis, and we'll actually use the foreskin of the penis for that reconstructive surgery. One of the main objectives of hypospadias repair is to make urinating and ejaculation and fertility easier and more comfortable for the patient. Shordee is when the penis curves downward because of a fibrous band. It can interfere with urination and later sexual function. Surgery releases that band, think of like a cord pulling on the penis, and straightens things out, sort of like snipping too tight of a bowstring. Cryptorchidism is the medical term for undescended testes. Normally, the testicles will migrate into the scrotum before birth, but sometimes one or both get stuck. If you can't palpate a testicle in the scrotum, it may be in the inguinal canal or abdomen. Surgery, called orchiopexy, is done if the testicle hasn't descended by 6 to 12 months of age. Why does this matter? An undescended testicle can lead to infertility and increased risk of testicular cancer. So the reason why we're going to do surgery to bring those testicles down is because we do not want the male patient to have infertility or testicular cancer because of undescended testes. Some things to consider. Surgery is held off until at least 6 months of age, because it could take up to 6 months of age for spontaneous descent of the testicle to occur. The ATI textbook lists up to 24 months for that window or time frame for the testicle to descend. But usually the surgeon's going to watch that first 6 months and then take action not long after that. Another thing to think about is when we're examining the child. We want to make sure that we have warm hands, the provider has warm hands, the environment is warm, and then we also want to position the child so that it helps to promote the testes to be in the scrotum. So the child sitting in a frog-legged sort of position. Sometimes the child might sit without a diaper on the parent's lap, but their bottom sort of hanging between the parent's legs to sort of let gravity and positioning help to bring the testes into the scrotum. Last up for this recording, testicular torsion. Ouch! Testicular torsion is an emergency. The spermatic cord twists, as shown in this diagram here. It's twisted around, cutting off blood flow to the testicle. The pain is sudden and severe, often with swelling and nausea. Time is testicle here. Surgery must be done quickly to save it. And if you remember one thing, remember that torsion is an emergency.